such a cool joint and be capable of so many different things, which is what makes it my favorite joint. A lot of people describe the architecture of the shoulder joint as this kind of golf ball on a tee, right? You've heard that analogy. Another analogy, which I've learned, which I like much better, is a golf ball on a seal's nose, right? Because the truth of the matter is that the scapula is not a static thing. It's actually dynamic and moving a lot of the time. So your scapula is constantly moving, and the humerus is constantly moving to kind of try and stay in contact with it, hence the golf ball on the seal's nose, which the seal's nose being so because of this architecture, the shoulder joint is capable of so much, but as a result of that, right, we lose some of the stability that we have with the hip architecture, right? It's built much more for stability, which is great because we're not really walking on our hands anymore, we're walking on our legs, so we've got more stability down here, more mobility up here. Now, there's too much mobility at times, right? And the problem can be when we dislocate a shoulder, right? So when we dislocate a shoulder, in what direction does that commonly dislocate? Most shoulder dislocations most commonly happen anteriorly, and that's because there's a lot of stabilizing structures around the shoulder, but that particular location happens to have less of those structures there, right? So you have a higher preponderance of dislocation happening now. But we do have nature has given us a ton of stabilizing structures to help us kind of keep our shoulders intact so we're not like walking around all the time, perpetually dislocating our shoulder joint. What are those stabilizing structures? Well, you can think about them in two different categories. We don't really teach this in gross anatomy, but it's just a way to think about it and put it in your head. There's the static stabilizers, which are things that don't move, and then there's the dynamic stabilizers, which are things that do move, both to stabilize the shoulder joint. The things that don't move are things like the labrum, right, that adds a little stability, the joint capsule, ligaments, you guys all saw this in lab, right? Now, what about the dynamic stabilizers? These are things that move that stabilize the shoulder joint. Anybody guess what I'm talking about? See that? What? Say it like you mean it.
Rotators.
Rotator cuff muscles, exactly. So rotator cuff muscles, yes, you learn about them in terms of their movements and how they impact the shoulder joint in terms of internal rotation, external rotation, and abduction. But they're actually their more important function really is stabilization of the shoulder joint. So these muscles come from the posterior scapula and the anterior scapula, right? So they're coming out, picture this is the scapula, they're coming out from the scapula, okay? And then all the muscles coalesce kind of into one common tendon, and they insert onto the humeral head. And what they do is they pull that humeral head in and they press it down slightly, okay? And this is that stabilizing effect. Yes, they effectuate movement, but their important role is stability of the humeral head. They're trying to keep it down and away